All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Barry Pierre, talking about one of these months that we get to highlight a special disease that gets a lot of fanfare. We know the month of October is the fourth quarter of the year. Everyone's kind of gearing up to the end. The leaves are changing to all types of different colors, but the one color that is typically pretty recognizable during this month, especially in my field of healthcare, is the color pink. It's because that is when we celebrate Breast Cancer Awareness Month, which is, I would say, one of the more popular, and I hate to even phrase it in those terms, but it just is what it is. It is one of the most popular diseases that we highlight, that we market when we're talking about this aspect of awareness. Of course, there's Heart Month, there's Prostate Cancer Month, Lung Cancer. There's all different types of months. If you've been here in this community long enough, you've seen me talk about it in one way, shape, or form. But Breast Cancer Awareness Month just gets a different level when it talks about funding, when it talks about, you turn on your TV, you start seeing different commercials kind of highlighting this aspect of wearing pink and the ribbon. And I want to talk about it in a different fashion. Now, for those, especially my Lunch Learn community, who want some in-depth, some medical discussion, some stats, I am going to have a blog post in the show notes that does all that for you, right? So check out the blog post in the show notes. It's going to give you those numbers. It's going to give you those facts. It's going to go a little bit more detail on some of the, more scientific aspect of breast cancer. Again, I'm talking to the person who wants to know a little bit more about breast cancer and then what they should be thinking about. So I always like to bring a scenario of the patients I've taken care of in the past, because I think a lot of times when we connect with a patient and instead of a disease, it goes a lot further, right? Because I can talk about breast cancer all day, every day, but it doesn't hit hard until you can say, you know what? I have a family member who was diagnosed with breast cancer. I have a family member who passed away from breast cancer. I have a family member who's currently being treated for breast cancer. When you can start internalizing and say, I have, or I know, then it becomes a little bit more of I don't want to say a gut punch, but it definitely registers longer in our long-term memory. Now, if you caught my live a few weeks ago, we did one on one of my childhood, crushes, Topanga, their official, who was diagnosed with breast cancer, and she let it be known on her podcast. Well, thoughts and prayers and wishes for that. Like what typically happens, usually when a celebrity or someone we can recognize lets us know, hey, I'm not superhuman. I have to deal with the same things you have to deal with. A lot of times it snaps a lot of us back to reality, say oh, I really need to get my stuff together. So I want to talk about my patient. I had a patient who, when I was doing outpatient medicine, who came in for her routine visit, just a routine, regular visit, hadn't seen a doctor in a while, which is, unfortunately, when we're talking about cancer, not seeing someone for a while is usually not a good recipe. And she came in, we had our discussions, I asked the questions that you typically have to ask, especially for a new patient. And, as I'm doing my thing, I get, I'm just letting her know, hey, based off age and your history, and you haven't seen, thinking we need to, screen you for breast cancer. And she said, yeah, doc, I think you're right. Right. And before she left the room, she said, doc, I have something to show you. And of course, this typically happens. If you do outpatient medicine, the amount of information that you receive from your patients in that last 5 minutes, right when they're about to leave, because again, a lot of times patients, they block out their day, they circle on the calendar, hey, I got a doctor's appointment. So they have a lot of questions that sometimes they don't remember it until they're about to get out of here. Cause hey, I'm not sure when the next time I see the doctor, let me go let him know now. And she was like, doc, can I show you something? I'm like, sure, go ahead. Let's, this is what we're here for. As we're doing our physical exam, I can see she has a bandage over her chest, over her left side of her chest, almost like a bandage, almost like a dressing of some sort, as if she, she had an injury, she got cut. And I'm like, why do you have this here? She said, oh, doc, I have this thing. It started out as a bump, and then it just kept getting bigger that I think I need to show you. When I tell you the mass, and I want to stress this, the mass that I saw protruding out of my patient's chest, it was only because of years of training that I was able able to keep a straight face while on the inside absolutely screaming like, what am I looking at? Because if you do a search, right? You do a search, and again, in the blog post that I'm gonna link, I'll put a couple pictures on there. If you do a search of breast cancer and, after the surgeon has to remove it, what it looks like. Again, I typically see that in the OR. I typically see pictures of it. Very rarely do I see what is breast cancer before any surgery is done. And I had a patient who, again, and that's why I stress that keyword a while. I had a patient who hadn't seen a doctor in so long and had this growth that had grown so much that it was protruding and had broken the skin and it was protruding out of her chest. And she said, Doc, I know something's wrong. I don't know what this is, keeps growing, and I don't know what to do. And again, I had to let her know. I said, you know what? I am extremely concerned. Because what I'm looking at now, I know we were just talking about getting a mammogram. I don't think I need to get a mammogram to know that you likely have breast cancer. Yes, it's an out of ordinary type presentation, but the story that of the origin of it isn't out of the ordinary, where you have, your patient who maybe not have seen the doctor in a while, or maybe they have seen the doctor in a while, but the doctor's not necessarily keeping up with their screenings and it goes unnoticed. This was something in this extreme case that not only did it went noticed, she had to start covering it up. And of course, fast forward the story. Yes, she was diagnosed with breast cancer. Yes, we had to go to surgery and chemotherapy and all these things here. And she did ultimately pass away because at that point it was already late stage, that had already spread everywhere. But it hurt me because I know that if I could have caught her 5 years prior, 10 years prior, and I just did a simple mammogram test, what we typically recommend to our patients starting at the age of 40, earlier if you have some family history, I know that I could have saved her life. And I think that's what I want people to really take home when they start seeing people wear pink, when they start seeing people wear these ribbons, when they start seeing sports franchises don pink jerseys and stuff like that. I want everyone to know that that's a representative of someone's life that could be saved or could not be saved because of awareness or because the lack of awareness. Because it is a cool thing. Like I said, I love when everyone wears pink. Pink looks great. I love when people wearing their ribbons. I love the fanfare of it. But I think a lot of times we will separate what that color really means, what that ribbon really means. And when we separate it, we don't attach it to, hey, I have a sister who was diagnosed with breast cancer. I have a mom who was diagnosed with breast cancer. My wife was diagnosed. We don't make that connection because we only see this marketing event that typically occurs. And again, I appreciate the marketing event that occurs because typically with marketing comes research, comes donations, earlier access to care. All of these things need to happen. Right. I'm not saying that the marketing aspect of Breast Cancer Awareness Month isn't important, because that'd be a lie. It's extremely important because research dollars and technology and everything that happens, even for a person who may not have it, it may now be available because, hey, I got some research dollars here that says I can get a free mammogram. Let me get my free mammogram. So it is extremely important. So we're not taking away from the onus of wearing pink and marketing that aspect of it. But I want us to connect that aspect of someone wearing pink to someone that they may be walking for, someone that they may be raising money for. I want us to continue to make that connection because I think if we continue to make those connections, because as a physician, especially in healthcare, I don't have the luxury to just say, oh, that's breast cancer and not connect it to someone. Diseases, especially as an osteopathic physician, one of my attendings always told me that we never look at a disease of its own, right? We never say, oh, that diabetic patient, that patient no, we say, hey, this is a person who has breast cancer. This is a person who has diabetes. This is a person, we always connect that person first because it makes it personable and it makes it so that we care just a little bit more instead of it saying oh, let me just take care of this diabetic number. Let me just take care of this blood pressure. Let me just take care of that disease. No, it's always a person with the issue, right? Because we want to make sure that we continue to center the person. And we want to make sure that person, again, is somebody's mom, could be somebody's dad, right? Because again, a lot of times you'll see breast cancer, and obviously the focus is always the women. Men are getting breast cancer as too, right? So it's not like, yes, it's obviously not as frequent as women, right? And that's a lot of hormone related issues and concerns. Again, I'll have a blog post for you guys who, want to know the scientific nitty gritty of it. But it's understanding that these risk factors are there. It's understanding that the treatment options are there, but the treatment options are slim if you don't know about it. So I don't want you hopping down my comments saying, oh, Dr. Pierre says like we shouldn't be, hyping up breast cancer awareness month. We shouldn't be all like, no, I want you to do that. Just like I want you to get your mammograms or breast ultrasounds. I want you to get your regular checkups to make sure you get those tests. I want to make sure that you're donating to research. I want you to do all of those things there, all those things that need to happen. I just want to make sure that we are bringing it back home and making it personable so that we just don't see a person wearing pink. We see, hey, this person is wearing pink because they have to look out for someone. This person is wearing pink because they may have lost someone. That is how these types of diseases, and when they do get the fanfare that they get, like that is how I always look at it. That is how I always remember it, right? And fortunate the way business is, once October is gone, those same companies don't wear pink anymore. Those same companies, right, aren't talking about ribbons anymore. But guess what? The people who have breast cancer still got it. Like it doesn't go away because the month of October went, right? The people who lost people due to breast cancer and its effects on breast cancer, they still have to deal with those effects too, right? So it doesn't go away because the month of October goes away. It's just the marketing aspect of it. Those same organizations that raise money towards breast cancer research and treatment and care, they don't go away because the month of October goes away. They just get less fanfare, and which means they have to work a little bit harder to get your money. That's my discussion for today. I think we've talked about this. I want to make sure that when we do have these discussions, we are really trying to make it more relatable to the patient, putting ourselves, even if we can't think about, maybe you're one of the lucky people who don't know anyone who's been affected by breast cancer in one way, shape, or form. We at least want to be empathetic to those who do. That's all I can say, right? So again, I'm yours truly, Dr. Pierre. Shout out to the month of pink. Donate to research. Join research. If you have opportunities to join any type of research towards breast cancer awareness, do that, please. Get your screening mammograms. Again, age 40. For those is when we typically start, unless you have some family history. Obviously, consult with your primary care doctor. They'll be able to educate you on when is it the right time for you. We will have a blog post in the show notes that kind of goes a little bit more detail on risk factors and signs and symptoms. All of that is good and all that you need to know. I just wanted to make sure we focus this episode on connecting that breast cancer, that pink ribbon, that pink t-shirt, that pink football jersey to someone who is being affected by the disease. See you guys next week.